Introducing the PiezoWave 2 Vet from Richard Wolf. The PiezoWave 2 Shockwave therapy is very effective at treating and resolving musculoskeletal injuries. The majority of PiezoWave 2 therapy sessions begin with slowly moving the therapy source across the general area of the suspected injury at a low intensity setting between 1 and 3 on the control unit. This establishes where the treatment needs to be applied by flaring the injury. Once established, the position of the therapy source is maintained on the area that is being flared, and intensity is adjusted based on patient cues. The PiezoWave 2 uses focused sound compression to effectively target and treat injuries at various depths of penetration, including disorganized or delayed healing of fractures, tendinitis, osteoarthritis, elbow and hip dysplasias, sesamoiditis, and chronic back pain. Connect the therapy source to the control unit. With the power cord connected to the control unit, press the power switch on. To prepare the therapy source, turn the black locking ring counterclockwise and remove. Apply a sufficient amount of the recommended LithoClear gel to the center of the contact surface of the therapy source. Place the gel pad onto the therapy source. Install the twist lock ring and turn it clockwise to lock. Select the gel pad in accordance to the required penetration depth. The number on the gel pad indicates the penetration depth of the therapy focus in millimeters. Turn the control unit on. The plus and minus buttons on the left and right side of the control unit control pulse speed and intensity respectively. For cleaning, turn the control unit off and disconnect the therapy source. Remove the gel pad from the therapy source by turning the twist lock ring counterclockwise. Clean the contact surface of the therapy source, the gel pad, and the twist lock ring in lukewarm water under the faucet. Then wipe with a soft cloth and surface disinfectant. Do not use cleaning solvents, scouring agents, or coarse brushes on the surface of the therapy source. Make sure that no water enters the therapy source at the junction of the handle and cord and the plug connector.
And then I started to research more about shockwave, the difference between focused shockwave and radial shockwave, high intensity, low intensity. It was all new to me because we had heard about it at Canine Rehab Institute in our training, but I had kind of dismissed it as a modality that I probably wouldn't get, that I would probably get ultrasound, but not shockwave, because I had kind of been told that it was A, it was very painful for the patient, B, that it was very loud, and those two factors meant that you had to sedate the patient in order to do the treatment. And those were the two main drawbacks for me, really. And C, I thought, well, I can't afford to pay so much for a piece of equipment that I might use a handful of times. What I've learned since then is that it doesn't have to be that kind of session. It can be low intensity, it's not loud, it's not painful, it can be an outpatient procedure, and it is with my patients, and I get tremendous results. It would be easier to tell you which cases I don't use it in when it's contraindicated as opposed to how to use it, because I use it in almost all of my patients. Primarily treating myofascial pain and osteoarthritis pain. What I soon started to realize was that laser and my hands could only do so much for some of the more fibrotic tissue. So these are the three big things that I think this machine gives me that my laser really doesn't, and that electrical stim, e-stim doesn't, and e-stim acupuncture doesn't. And I've had all these modalities on myself, and I can say that this also provides me with the most instant pain relief. So it's acute pain relief, and there's a number of studies out there looking at the reasons why, whether it's due to competition at the dorsal root ganglion and inhibiting the descending pain pathways, or stimulation of the A delta and blocking the C fiber transmission, affecting substance P and other chemicals in the inflammatory process to relieve inflammation, and even mechanical compression. This is what I found most interesting, the mechanical tapping of the sound wave itself, tapping on the very small nociceptive fibers, the very unmyelinated superficial fibers, could actually be kind of basically depolarized and not able to regroup themselves, not able to start firing again. And so it was an immediate relief of myofascial pain and tension. And I wanted that for my patients, and I see that in a number of my patients. So pain relief is the number one thing I'm using this for. It also softens tissue immediately. If the muscles are tense, they're no longer tense when you relieve the pain, and I can stretch them better. I can do my manual therapy better. The patient relaxes better, right, Donna? The patient relaxes, and literally I'll go from having a shaking, quaking dachshund with the eyes bulging, muscle fasciculation as I palpate up the spine, and dropping in the center when I get the T10, and then halfway through the treatment, they give an exhale, they sigh, they put their head down, and then they stretch out like a rubber band, and no more muscle fasciculation by the end of my treatment. The clients and I can both see it, the dog feels it, and it's a great thing. The second reason that one might want to use this machine would be, a big reason would be to break up tissue, that's scar tissue, calcified tendons, ligaments, myofascial trigger points or knots within the muscle. It's a really great tool. I know acupuncture needles are great for myofascial trigger points as well, but I find that treating with Shockwave, I'm not just treating locally in the trigger point, but I'm fanning through the whole muscle belly, and I'm getting the fibers and the whole fiber, where the trigger point is maybe just a bunched up collection of fibers at a motor segment of the muscle. I'm treating the whole tissue, I'm treating all the fascia, all the superficial nerves that are in that area, the layers of muscle, depending on how deep I go with my gel pad. So breaking up tissue, blocking pain, and then lastly, another big biological effect when you look at the literature is stimulating regeneration of tissue. It jumpstarts the growth factors coming in to build more fibroblasts, collagen stimulation, chondrocyte and osteogenesis, so bone remodeling, cartilage repair, fibroblast production. So it's great for those non-union fractures. It's great for comminuted fractures. If you're a surgeon and you're treating a patient and you're putting Humpty Dumpty back together again, and there's a lot of soft tissue trauma and fragments, you know, I liken it to, I think of it as debriding the bone without getting a scalpel blade into the tissue. The little pulses, the shock waves themselves mechanically are tapping the tissue and causing that little microvascular trauma and encouraging remodeling. So, and I'll just show you a little bit of what the treatment would look like. Okay, you're okay, Donna. So I'm at 8. So I'm down at 6 is my pulse frequency, and I'm at 0.5, and I'm treating the area that primarily she has had myofascial pain in the past. Today, normally I checked her before the start of this webinar. I would palpate for muscle fasciculation, and I look for that fasciculation, and I start treating in that region. I'm aiming my probe slightly at a 45-degree angle towards the multifidus muscle. At 1.5 centimeters, I should be on multifidus, and I'm at the transverse processes where the spinal nerves are coming out. I know that those spinal nerves are heavily myelinated, and there's no way that this intensity of energy is going to hyperpolarize those nerves, but it is going to affect the nociceptors and the tissue around those nerves, relaxing them, and so it's a good way to block pain distal to the limb based on the spinal segment that I'm treating. But in her case, I'm also treating based on her pathology, where she has evidence of myofascial pain. And basically, every patient that I see has myofascial problems, whether it's from a post-TPLO, whether it's from patella luxation or post-patella surgery, whether it's cranial cruciate ligament, chronic disease, hip dysplasia, elbow dysplasia, and of course, you get the muscles surrounding those joints are trying their best, are compensating for the unstable hip or the painful elbow or the painful shoulder by overuse strain, muscle strain.